Hello, I'm Dr. Douglas Stevens, Adult-Gerontology Acute Care Nurse Practitioner Track Coordinator at Jacksonville State University. Here at Jacksonville State University, we offer a Adult Gerontology Acute Care Nurse Practitioner track that prepares nursing students for an exciting opportunity to advance their nursing careers. The Adult Gerontology Acute Care Nurse Practitioner is an advanced practice nurse who uses theory, research, and clinical expertise to provide care for acute and chronically ill patients in a variety of settings. The adult gerontology acute care nurse practitioner role arose from adult nurse practitioners whose responsibilities evolved to include patients in the hospital setting. The adult gerontology acute care nurse practitioner currently provide advanced nursing care across the continuum of healthcare services to meet the specialized physiologic and physiological needs of patients with complex, acute, and critical and chronic health conditions. The adult gerontology acute care nurse practitioner practices in any settings in which patient care requirements include complex monitoring and therapies, high-intensity nursing intervention, or continuous nursing vigilance within the range of high acuity care. In addition to managing patients' care, the adult gerontology acute care nurse practitioner utilizes invasive interventions and procedures to promote physiologic stability. The adult gerontology acute care nurse practitioner performs a variety of skills and procedures, and the skill set of an adult gerontology acute care nurse practitioner is often dependent on the specific patient population and specialty-based area of practice. The adult gerontology acute care nurse practitioner engaged in the diagnostic process, including critical thinking involved in differential diagnoses and the integration and the interpretation of various forms of data. The focus of the adult gerontology acute care nurse practitioner is restorative care, and the short-term goals include patient stabilization, minimization of complications, and the promotion of physical and physiological well-being. The long-term goal is to restore maximal health potential while evaluating risk factors in achieving this outcome. In order to be eligible to apply for the adult gerontology acute care practitioner track, registered nurses must have 2 years of full-time work experience in an acute care setting before the start of practicums. The education and clinical preparedness of the adult gerontology acute care nurse practitioner includes an extensive foundation in pathophysiology, pharmacology, evidence-based management of complex patient problems, and leadership within the healthcare system. The primary goal of the adult gerontology acute care nurse practitioner specialty track is to prepare graduates to provide advanced nursing care to patients with complex, acute, critical, and chronic health conditions, including a delivery of acute care services. Coursework, clinical experience, and research utilization provide students with the knowledge, values, and skills necessary for advanced practice nursing roles. Adult gerontology acute care nurse practitioner specialty will have a very challenging yet rewarding experience. Graduates of the specialty will possess the knowledge, skills, and tools necessary to care for patients with complex, acute, and chronic illnesses. Graduates of the program are eligible for the certification through the American Nursing Credentialing Center and Adult Gerontology Acute Care Nurse Practitioners. The structure of the curriculum for Adult Gerontology Acute Care Nurse Practitioner Specialty is based on the guidelines of the Acute Care Nurse Practitioner Competencies as defined by the National Organization of Nurse Practitioner Faculties. The track offers 2 plans of study, a 12-semester option and a 15-semester option. 12-semester option is the full-time track, and the 15-semester option is a part-time track. In the Adult Gerontology Acute Care Nurse Practitioner track, the practicums will be performed in the master's portion of the program, while the residency hours will be performed during the DNP segment of the program. There is a strong partnership with local health systems, which allows a rich and unique environment for developing expertise in acute nursing care. The Adult Gerontology Acute Care Nurse Practitioner students will perform practicum and residency experiences in acute and hospital-based settings, emergencies, urgent care, intensive care, subacute rehab, long-term care, and specialty ambulatory centers. As changes in healthcare reflect the trend of cost containment and shortages of healthcare providers, the Adult Gerontology Acute Care Nurse Practitioner role continues to emerge. While most adult gerontology acute care nurse practitioners practice in acute care and hospital-based settings, including subacute care, emergency care, and intensive care settings, the continuum of acute care services spans the geographic setting of home ambulatory care, urgent care, and rehabilitative care. The population in acute care practice includes acutely and critically ill patients experiencing episodic illness, exacerbation of chronic illness, or terminal illness. Jacksonville State University Adult Gerontology Acute Care Nurse Practitioner Program prepares students to become experts as adult gerontology acute care nurse practitioners. With a flexible schedule that includes core courses, practicums, and capstone options, our students have the opportunity to enhance communities around them while becoming the next generation of healthcare leaders.